For some kind of extra tips and pointers, we know our veins are the blue lines that carry our blood in our body. This would be if we took a section out of that vein. So children know that blood is red, so if they can see when they reach inside, that would be like some of the blood that's in there. When they pull these out, they're again a very comfortable size for them to manipulate and explore. And so I recommend just having it in an open space that you can have out on a table so that they can really look at them. There's no right or wrong order to go in. If you're describing all of the blood cells, there's no right or wrong order to go in if you're explaining all of the germs, but just have only the pieces that you need inside. And so the first four primary ones are going to be your basic blood cells. And what's great about this is it doesn't matter which order the kids pull them out in, but you're going to say, oh, what is this? What does that look like? And it's a red blood cell. And red blood cells are our energy cells. And what they do, and they are running shoes, so that makes it really easy for them to understand, is they carry oxygen and they give our body energy. So back we might say, what might happen if you didn't have enough energy cells, red blood cells? And they'd say, oh, you might be tired, you might be weak. And we say that's right, because we really need to have those energy cells in order to get plenty of oxygen throughout our body. What might happen if you didn't have enough white blood cells, those fighter cells? Oh, your body might get very, very sick. And you're like, that's right, that's why we need white blood cells. What might happen if you didn't have enough platelets? And this is my favorite because they always say, you bleed to death. And I say, well, probably not bleed to death, but it is very important for our body to have enough of the platelet cells to go and cover up to stop the bleeding. So once you get the foundation that there's something there that's not supposed to be there, we can say the specific one in your body is, and we can point it out so that way they can see it's a fungus or it's a bacteria. And so we have subsequent cells that go exactly along with that. Again, it looks exactly like what they're going to see under the microscope. So that's really key because the cartoon image is going to help them really solidify that in their mind if they have the opportunity to see the actual cells. I love it that they're two-sided because that way I can see exactly what they see, which is really essential, whether they're holding it or I'm holding it. You can really always keep it straight. They're easy to clean, which is really important. You don't want to have any infection issues. Another great thing that this is good for is for HIV teaching. And so actually in the book there is a five-step process that walks you through a really efficient and effective way to help children understand the disclosure process of their HIV diagnosis. The HIV one, you can see they all have the same shapes, it's the same look, but in order, if you're teaching about specifically HIV or if the child has progressed to AIDS, you've got a little bit deeper intensity of color, you've got more of the, I'm calling them horns and trumpets, but it's actually kind of a little bit more intensity. So that is, since we have one of each cell, that's the way that you're going to be able to help them see the greater quantity. So if you're just talking about HIV, you would start with this one. You don't need the AIDS one, but if a child has progressed to AIDS, you're going to be able to use the deeper color, but that's just so that you will know. And then you can talk about how it all interacts. So your teaching guide's going to walk you through, there's actually a grid, and it's going to show you many of the diagnoses that you would be able to actually teach about and exactly which cells you would use. There's a step-by-step guide in here that's going to show you what all of the discs are, as well as in-depth descriptions of what each of those are that would help you from preschoolers all the way up through adolescence. We were so glad to have the opportunity to work with Legacy Products, and Tara Collins and I are both certified child life specialists, and we know that they have great teaching products, and we hope that this helps you help patients and families understand all types of illnesses, all types of chronic illnesses and acute illnesses, as well as just the basic premise of their blood.